Top 7 Best Fruits for Diabetics. Number 7. Cherries, the inflammation fighters. Cherries are a delightful treat that offers significant benefits for those managing diabetes. They are rich in antioxidants, particularly anthocyanins, which have been shown to reduce inflammation, a common issue in diabetes that can lead to complications like heart disease. A cup of cherries contains about 90 calories, 22 grams of carbohydrates, and 3 grams of fiber. The fiber helps slow down the absorption of sugar, aiding in blood sugar control. Cherries also provide vitamin C and potassium, supporting immune function and heart health. Historically, cherries have been enjoyed since ancient times, with records of their cultivation dating back to 300 BC in Greece. A fun fact: cherries can help alleviate joint pain due to their anti-inflammatory properties. For a tasty treat, try a cherry smoothie, a spinach and cherry salad, or simply enjoy them fresh. 1 cup per day is a good serving size. Cherries are in season from November to January in Australia, but can be frozen for year-round enjoyment. Prices vary but generally range from $10 to $15 per kilogram. Number 6. Pears, the gentle sweetness for blood sugar control. Pears are a delightful choice for those managing diabetes. A medium-sized pear contains approximately 100 calories, 27 grams of carbohydrates, and 6 grams of dietary fiber. The high fiber content, particularly soluble fiber, slows down digestion, leading to a gradual release of glucose into the bloodstream, which helps prevent blood sugar spikes. Pears are also rich in vitamin C, which supports immune function, and potassium, which aids in blood pressure regulation, a common concern for diabetics. Historically, pears have been cultivated for thousands of years, originating from Europe and Asia. A fun fact: in ancient Greece, pears were considered a remedy for nausea. For culinary inspiration, consider these recipes: pear and walnut salad, baked pears with cinnamon, or a pear smoothie. The recommended daily intake is 1 medium pear. Pears are typically in season from late summer to early winter, but they freeze well, allowing for year-round enjoyment. Prices vary but generally range from $2 to $4 per kilogram. Number 5. Kiwi, the nutrient-dense powerhouse. Kiwi is a small fruit packed with nutrients beneficial for diabetes management. 1 medium kiwi provides about 42 calories, 10 grams of carbohydrates, and 2 grams of fiber. It's exceptionally high in vitamin C, offering over 70% of the daily recommended intake, which supports immune health and acts as an antioxidant. Kiwi also contains vitamin K, vitamin E, and potassium, contributing to heart health and blood pressure regulation. Originating from China, kiwi was known as the Chinese gooseberry before New Zealand growers renamed it for marketing purposes. A fun fact: kiwi contains an enzyme called actinidin, which aids in protein digestion. Here are some recipe ideas: kiwi parfait, kiwi salsa, or a kiwi smoothie. Aim for 1 to 2 kiwis per day. Kiwi is in season from May to November in Australia, but can be frozen for later use. Prices typically range from 50 cents to $1 per fruit. Number 4. Oranges, the classic vitamin C source. Oranges are a staple fruit that offers numerous benefits for diabetics. A medium orange contains about 62 calories, 15 grams of carbohydrates, and 3 grams of fiber. The fiber helps regulate blood sugar levels, while the high vitamin C content supports immune function and acts as an antioxidant. Oranges also provide folate and potassium, which are essential for heart health. Native to Southeast Asia, oranges have been cultivated for over 4,000 years. A fun fact: the orange tree is the most cultivated fruit tree globally. Consider these recipes: orange and almond salad, grilled chicken with orange glaze, or an orange smoothie. 1 medium orange per day is recommended. Oranges are in season from June to October in Australia and can be frozen or juiced for off-season use. Prices generally range from $2 to $4 per kilogram. Number 3. Apples, the everyday superfruit. Apples are widely accessible and beneficial for blood sugar management. A medium apple has about 95 calories, 25 grams of carbohydrates, and 4 grams of fiber. The soluble fiber, pectin, slows digestion and helps control blood sugar levels. Apples also contain vitamin C and various antioxidants that combat oxidative stress. Originating from Central Asia, apples have been cultivated for thousands of years. A fun fact, the saying, "an apple a day keeps the doctor away," dates back to the 19th century in Wales. Try these recipes: apple and peanut butter slices, baked apples with cinnamon, or apple and cabbage slaw. One medium apple daily is a good guideline. Apples are in season from March to May in Australia, but store well in cool conditions and can be frozen. Prices typically range from $3 to $5 per kilogram. Number 2. Grapefruit, the metabolism booster. Grapefruit is a citrus fruit known for its tangy flavor and health benefits. Half a grapefruit contains about 52 calories, 13 grams of carbohydrates, and 2 grams of fiber. It's rich in vitamin C and antioxidants, which support immune health and reduce inflammation. Grapefruit has a low glycemic index, meaning it doesn't cause rapid spikes in blood sugar levels. However, it's important to note that grapefruit can interact with certain medications, so consult your healthcare provider before adding it to your diet. Originating from the Caribbean in the 18th century, grapefruit is a hybrid between a pomelo and an orange. A fun fact, the name grapefruit comes from the way it grows in clusters, similar to grapes. Enjoy grapefruit segments in a salad, broiled with a sprinkle of cinnamon or as a refreshing juice. Half a grapefruit per day is a common serving size. Grapefruit is in season from April to September in Australia and can be refrigerated for extended freshness. Prices generally range from $2 to $4 per kilogram. Number 1. Berries, the antioxidant-rich champions. Berries, including strawberries, blueberries, and raspberries, are excellent for managing diabetes. 1 cup of mixed berries contains approximately 70 calories, 17 grams of carbohydrates, and 4 grams of fiber. They're rich in antioxidants like anthocyanins, which reduce inflammation and improve insulin sensitivity. Berries also provide vitamin C and manganese, supporting immune function and metabolism. Berries have been consumed since prehistoric times, with various cultures valuing them for their medicinal properties. A fun fact, blueberries were used by Native Americans to dye fabrics and as a food source. Here are some recipe ideas: berry yogurt parfait, berry spinach salad, or a berry smoothie. Aim for 1 cup of berries daily. Berries are in season from November to April in Australia, but freeze exceptionally well for year-round use. Prices vary, with fresh berries ranging from $4 to $8 per punnet, and frozen options often more economical. Incorporating these fruits into your diet can aid in managing diabetes effectively. Remember to pair fruit intake with a balanced diet and regular physical activity for optimal health. Always consult with a healthcare provider or dietitian for personalized dietary advice.